Hello, am I audible?
Yes, ma'am.
Okay.
Good afternoon, Dr. Unmona.
Good afternoon.
Good afternoon, my dear team at Dr. Mehta's.
Good afternoon, ma'am.
All the best.
Yeah, thank you.
Good afternoon, Lina.
Good afternoon, ma'am.
We'll start off with Dr. Unmona addressing, then
Yeah.
it will come to me, and then we'll move on to the team, ending with the patient. Then it comes back to me, and then I hand it over to the Vice President, Dr. Rachel. She does the vote of thanks.
Four minutes. Shall we
Rachel.
start?
We have, can we wait for another few minutes, Doctor?
Okay. Okay.
Let few more join.
Hi guys, wish you best of luck. Tamil Nadu team, Unmona.
Hi, Vinci. Thank you.
Thank you, Vincent. Can we wait for another 3 to 5 minutes, Dr. Unmona?
Okay.
Thanks.
Hello.
We'll begin, Doctor.
Lina, shall we go for it?
Yes, we'll start.
Good afternoon, one and all present over here. We are from Association of Nurse Executive of India, here to have the Empower Hour to empower our nurses. Particularly 2024, we have thought of engaging patients and raising their voice, having heard their concern, so that we can prevent a lot of harms and we can improve our healthcare. So with that theme, we already started 2 states. Now we are coming to the Tamil Nadu chapter. So just to talk about, all of us, we know what are the vision of ANEI. There may be a few new members. I just would like to tell for them, our vision is to provide leadership. Association of Nurse Executive of India is known for developing the leadership, professional development, with different workshop, training, and conferences we are conducting regularly and research to advance nursing practice, nursing education, patient care, while contributing effectively towards India's health goal. So we are putting all effort, practice, education, and research. With that, we are developing the leadership. Under this, we are having the mission to work with all stakeholders in establishing a national system for improving nursing scenario across India, thereby impacting patient safety and clinical outcomes in all healthcare settings. So finally, we want to have an impact in the patient safety through uplifting the nursing profession with their skill, knowledge, and approach. So we are having all these chapters will be included from different states over the year with that theme. And just to talk about that, our national officials for this year is Ms. Ajita Nair, ANI National President, ANI National Vice President, Dr. Unmona Borgohai, Ms. Vinci Tribhuvan, ANI National Secretary, and Lieutenant Colonel Dr. Aji KL, Treasurer, National Treasurer. And also, we are very proud to have our people who are the founder officials, Ma'am Thangam Gamis, Ma'am Jyoti Clara, Ma'am Subodha Sagurikar, and also Ma'am Ajita was there as a national treasurer earlier. As I have already said, the two chapters from Northeast Punjab covered. Then we are coming today to the Tamil Nadu chapter. Next will be the Kerala chapter, UP, West Bengal, Jharkhand, Haryana, Delhi, Telangana, Karnataka, and Maharashtra. These are the different chapters. And today we are having this Empower Hour. And before I hand over to Miss Lina, chapter head of Tamil Nadu chapter, as our Madam Ajita is not here, as Miss Vinci is here, I would like to request her just to address the gathering over here.
Hello, everyone. A very good afternoon to you all. Thank you, Dr. Unmona. And it is one of our, STAR initiative where we are very, very focused and very serious about patient safety. We have already had a very successful year-long program last year. Then each element of the patient safety we focus. And today we are here engaging patients for preventing harm. And I wish Lina and other team members of Tamil Nadu ANI chapter all the best, and I hope it is a very enriching session and we take away some kind of learning from here and go back to focus on our patients and their safeties. Thank you.
Thank you, Madam Vinci. Thank you, Madam Unmona. It's a great opportunity for Tamil Nadu chapter to present what we can learn from our patients for the sake of our own patients for getting admitted with us in future. Meaningful engagement of patients, families, and communities can certainly improve our healthcare quality and patient safety. So it is good that we get feedback from our patients and their attendants who are with us in the hospital to improve our services. Adverse events or harm may result from problems in practice or with products or with procedures or with our systems, which are not usually the fault of us. They are a repository of critical information, and they can, that is, patients and attendants, they can share a lot of information with us, which will empower our team to move forward and to make their life safe in hospitals. So engaging patients and families and getting their experience can certainly provide a lot of insights and learning to our own people. So patients and healthcare users' experiences and perspectives are needed in efforts to achieve integrated and people-centered health systems and services. It is therefore essential to ensure that their voice is heard. I thank the team here who agreed to spend their time today to tell us all how it is to involve our patient for patient safety. We have with us patient Ms. Palniamal, the physician who treated the patient Dr. Sneha, the ward in charge Ms. Baby Lakshmi, and the hospital medical administrator, Dr. Jose, with us, who will interact with the patient to bring out all the patient positive and negative experiences and use the negative experiences to make our systems and processes strong and stronger for better patient care. Over to the team.
Good afternoon. I am Dr. Sneha, treating physician of Mrs. Palni Ammal, who was admitted under me as she was suffering from TB lung. Hi, Palni Ammal.
Hi,
How are
doctor.
you? How are you
I'm
feeling
fine.
now? Has the symptoms reduced, Palni Ammal?
Yes, doctor. Initially, I was suffering from high-grade fever and loss of appetite and cough, but everything is reduced now. I'm free from disease. Thank you very much, doctor.
I'm very happy to hear this from you. Mrs. Palni Ammal, I would like to ask you some questions regarding my treatment and follow-up during your hospital stay so that I can improve on my way of management of patients. Can I?
Yes, doctor. Please.
Do you think my way of disclosing the disease made you panic?
Certainly not, doctor, because you explained it in a calmly manner, and also I didn't have any doubt about my disease condition. So in that way, you have explained to me, so to me and to my family. So we didn't have any fear and anxiety, doctor.
Thanks a lot. Was my communication and explanation regarding investigation and treatment and other processes clear and understandable?
Yeah, I understood clearly because you explained me about the treatment, like what are the purposes behind that. For example, you have did a CT scan guided biopsy for me, so you explained it thoroughly. So what is the risk behind that, and what are the benefits by doing those kind of procedure and everything? So it made me to understand it clearly, doctor. You were communicated well about my treatment and plan.
Was my explanation regarding the drug complication and actions clear to you?
Actually, I was shocked when I had orange color urine. That I think you missed it, doctor.
Yeah, that will be because of rifampicin. I didn't tell you. Over to baby Lakshmi.
Hi, Ms. Paraniamman.
Hi.
Nice to meet you. Hope you are doing well. I think you remember us.
Yes, I remember you, sir.
Okay. So I would like to hear your feedback based on our nursing care, which was rendered to you during your stay at our hospital. And I have few set of questions. And my first question is, did our hospital nurses provide you timely care, especially with medications?
Yes, doctor, your nurses provided me timely care, but a couple of times they have attended the urgent call bell in a delayed manner, which I really needed assistance to go to the washroom. So coming to the medications, the nurses gave me all the medications at right time. But rifampicin was given half an hour delay once. But other than that, they've given timely care, and also they attended my all needs and care.
Okay, thank you, Ms. Paraniammal, for bringing it up to our notice. We'll keep educating our nurses about the timely care and we'll keep reinforcing them. And regarding drugs, our hospital has the practice of indenting drugs for 24 hours. That is the next 3 doses we used to indent and keep. I really don't know where it went wrong. Let me also check and make sure our pharmacy stocks the essential drugs in adequate supplies. Thanks for coming to bringing it to our notice. Thank you very much. And my next question is, did our nurses demonstrate sympathy, empathy, and courteous behavior to you?
Yes, sister, your team were showed empathetic and sympathetic towards me throughout my hospital stay. So, for example, your hospital staff, they spend much time with me to listen. They listen my concern. They addressed immediately, and also they ensure that whether I feel comfortable and supported. So here one thing I want to mention, Sister Divya. She's the one so kind and taking care of me throughout my hospital.
Okay, thank you, Ms. Parimal, for the special mention on Ms. Divya. So I do convey your positive feedback to her. Thank you very much for your positive feedback. And my next question is, how about our nurses' communication with you whenever they visit you?
Communication was excellent, sir. They were communicating with me very well. And every shift the nurses
ஓகேங்களா இது வீடியோவும் ஆஃப்ல இருக்கு நீங்க பார்ட்டிசிபேஷன் வந்து 78 மெம்பர்ஸ் நீங்க இந்த இதுல இருக்கீங்க
they treat me and they explain, they will ask about my condition and also they will explain about the plan of care, what they're going to do the whole day. So that was a communication, and also I noted few of the junior nurses lacking in that. So definitely they need to improve their communication skills system.
Certainly, Ms. Parimal. Thanks for the valuable feedback. We keep reinforcing our nurses about the communication skill, especially the new nurses. We'll continue to do that, and I'll take this valuable point on improving the communication, especially for the freshers. Thank you very much. And my hospital administrator is waiting, and he'll be asking you a few questions. I'll be joining you back.
Okay. Okay.
Good afternoon, Mrs. Palniamal.
Good afternoon, sir.
I'm Dr. Jose. I'm the head clinical operations, Dr. Mehta Hospital. I do believe we haven't met before, but it's nice to have you in this meeting.
Yes, sir.
Please feel free to share your opinion and feedback. It is only to improve our hospital services and the patient safety. So I'll move on to my first question.
Okay.
Were you admitted in a room which was in isolation and given separate patient care?
Yes, sir. Yes, sir. I was kept in isolation. I had a separate nurse allocated to take care of me, but they kept changing every day. That was a bit inconvenient to see and identify new faces every day during my lengthy stay, sir, in the hospital.
Okay. That's a good input. I will surely speak to my nursing head and ensure that the changing of nurses will be reduced and probably it'll be less nurses which will be rotated. I'll look into that. Thank you for your feedback, ma'am. Mrs. Palniamal, my next question. Yes. Were you permitted to contact your family through phone or video call during your stay with us? And were attenders allowed to meet you with N95 mask?
Yes, Dr. Mehta's hospital had provided me with tab and Wi-Fi connectivity to contact my family members whenever needed through video call also. It was
Sorry, ma'am.
Sorry, sir.
Yeah.
The attenders were restricted, but they permitted our relatives to meet me once in a day. And
Okay.
one thing I noted, they didn't provided the N95 mask to my husband, so he was very unhappy about it, sir.
I'm sorry about that, and I think you should probably just convey my apologies to him. I'll ensure that N95 masks are made available for the patients next time. Whenever we have patients in isolation, I'll note that down, and I'll take care of it. Thank you, Palniamal. My next question to you: were all the cost details of the treatment explained and doubts clarified to your family?
Yes, sir. The billing staff have done a great job in taking care and explaining about the bills in detail patiently to my husband, and all their doubts they were clarified, and also there were no hidden cost. There were more transparency and affordable rates also.
Thank you, ma'am. Value your feedback. And now back to Dr. Sneha.
Mrs. Palniamal, did you feel I have spent enough time to clear up all your doubts during my rounds?
Yes, doctor, you were with us all the time and you were clearing our doubts. Whatever we have doubt, immediately you cleared. And you are more approachable during your visit. There is no doubt in that.
Thank you. My last question, was my discharge summary clear and was I easily approachable?
Yes, everything was involved in the discharge summary, and also you clearly given instruction about my treatment, about the medication and everything, what are the precautions taken. So everything you have explained to me. Only one thing I noted that whenever I feel to visit you, many of the time you have come for the rounds during the night time. So that was I feel very bad that one. So better to have during the daytime instead of coming at a late night.
Thank you for your valuable suggestion. I will try to come in the evenings or morning. Over to Baby Lakshmi sister.
Yes, Ms. Paraniamal, I have a couple of questions with me. And how effective was our health teaching specific to your disease condition?
Yes, they were given health education since admission to discharge. Health education means it's about the importance of diet. Diet means it's rich in protein and also the medications, the side effects and respiratory precautions. Everything they have educated me. The one more thing I noticed in your hospital is QR code system. That is the very nice system. It was very useful and effective method, I think.
Thank you. Thank you for your valuable feedback. Yes, Ms. Parani, we do have the practice of preparing the health education videos for the customers, and we make it into a QR code system, which we have shared you during your admission process, right? So we have been doing more such videos for our customers, for the benefit of our customers. Thank you for your positive feedback. And my last question is, are your family members comfortable during your hospital stay?
Yes, they are okay. They felt comfortable during the stay. Only thing coming to the attendant food, they were charged extra for that food. That you have to look into, sister. It should not happen in the future for any kind of patients.
Okay, thank you, Parnimal. I've just noted it. We'll just talk to our management to provide food for the attendance at the subsidiary rate, as you told. Valuable suggestion. I'll make a note of it. Thank you, Ms. Parnimal. Thank you very much. Over to our medical administrator.
Yeah. Thank you, Sister Devi. Yeah. Mrs. Palniamal.
Yes.
My fourth question. Are you happy with the services provided at the Dr. Mehta's hospital? Would you refer your family or friends to our hospital for treatment?
Yes, the services were outstanding and very personalized. So we were greeted with respect at the admission desk and promptly taken to the room. There was no delay or social stigma. Yes, will definitely will refer my family or friends to your esteemed institution. So my family members also very satisfied with the care and treatment given here. And my daughter also, Divya, she likes very much Dr. Mehta's hospital, sir.
Thank you, Mrs. Palniamal. I'll take that as a compliment to my team and to the staffs. Thank you very much. I'd go on to the final question. How did you know about Dr. Mehta's hospital? And what are the things that you liked most during your stay at the Dr. Mehta's?
Actually, my neighbor's mother, she's a cancer patient. She's currently undergoing chemotherapy at Dr. Mehta's hospital. So my neighbor had suggested when I was inquiring for a good and reliable hospital. So I enjoyed the hospitality, respect, care, and prompt treatment. So the ambience was also very nice. I was treated very well. So overall, I thank you, sir, and Dr. Mehta staff.
Thank you, Palniamal. Thank you.
Thank you very much.
Thank you, Palniamal.
Thank you, sir.
Thank you, team, for bringing out your conversation to the audience. So thank you to Dr. Sneha. She was the treating physician, and Baby Lakshmi was the ward in charge. And Dr. Jose was the medical administrator of the institution. They had collected feedback pertaining to the treatment, the nursing care, and the overall hospital experience of the patient right from the time they entered till the time she got discharged. I thank patient Parni Amma especially on this day because she's a patient who had taken treatment at our hospital. She was diagnosed with tuberculosis, pulmonary tuberculosis, and she had to be admitted for 15 days because had complications while they started her on ATT drugs. Thanks, Parniamal. I hope you're doing well now. And it was very good to hear all the positive feedback from you. And of course, every team has got scope for improvement, right? So that is what we felt when we heard all those tough experiences that you've had. We will certainly go back to each of our teams and see how we can improve our systems and processes. So thank you for this time. Thanks for coming here and thanks for sharing your experience. We will certainly improve our patient services by using your feedback. Thank you, team. Over to Dr. Unmona. Would you like something? And Dr. Vinci.
Okay, thank you very much to the Tamil Nadu chapter. But however, in the entire discussion, I felt like, more of the toucher to the patient, like you all have asked so many questions to the patient, and anyway, happily she is answering to it. However, this session particularly that we would like to know, like, what could have been better, how we can do as a whole, sometimes like we have to inform the patients that before you come to the hospital, what are the things that you have to make a list and let the doctor know or the treating physician know about you. That will be helpful about like a kind of allergies and etc. And during your stay, how you feel, doctors, as of course you have said that coming night visit is not comfortable, and the delay in like when a patient has some need and demand, not only medication, just to get assistance to go to bathroom, to go to toilet, or like whatever. So if it is delays, it gives more pain and trouble to the patient. So we have to be alert about it. The patient who cannot move from bed, that we should have some device of call bell or someone need to be there. This is one thing. And particularly the things that patients whatever is not comfortable, this is a platform they can put up. When they are putting it up as a whole nationally, we can take some decision, and we can make some guidelines and protocol so that future it will not happen. And particularly, yes, today we have seen the scenario of Metis hospital. Anyway, it is doing great, but the thing is that many of the things, it may not be available in many other hospitals. And I really salute to the doctor that directly asking, how do you find my service and what are the things to improve? That's absolutely fine. But however, we also have to be curious, like kind of patients come to us, how we can make it available for them, and the facilities are raising their feedback and all, and how promptly we address, not only waiting for the session like this to hear. So immediately when the complaints will come, how promptly we can satisfy the patient so that harm will not happen. Say, for example, the allergies, say, for example, the kind of medications already patients are having earlier, and the complications may have for some medications, particularly for tuberculosis treatment, for medications, lot of complications occur. So like the education management, when we are giving the drugs, are we really giving them good education? I just would like to have a question to the Miss Palanyamal. What do you say about when you have been discharged, how you have been guided to carry on the medications?
Pardon me, ma'am?
So you might be continuing some medication after discharge of the hospital, right?
Yeah.
You continued
they
some
told-
medication after discharge. So are you been taught well that importance of each medication and complication of each medications?
Yeah, they were at the time of research, they explained everything about the complication and side effects of the medications and how long I have to continue and how frequently I have to do the investigation like liver function test and everything. They've explained. And
yeah, this is it is very, very important, very vital. Even I have seen the patient underwent the heart surgery, okay, bypass graft or like valve replacement. If the teaching is not given appropriately, like you have to continue the lifelong medications for the valve replaced patient, and you have to do the regular blood test, then complications occurs actually. So like patient has got the right to know everything in very detail. It's great that you have come to know. So anything else that you would like to tell as a whole to the healthcare service provider, that what are the 3 important points that you expect as a patient to improve as a whole, not mentioning to that hospital, as a patient, what will be better? How we can improve our service?
yeah, by approachable, all healthcare.
Okay, you want the first thing to be approachable. Very good. Next.
And explanation of the in the beginning. So after that only, after I had orange color urine only, after that only, then I went and informed to the healthcare provider. Then only they explained to me. So before starting or before giving any kind of treatment or medication, we should be informed to the patient.
Okay. Anything else? One more point. Approachable explanation. Yes. Then
Almost they were all actually they should post whoever is the known person, because the junior were taken care of me. If anything I ask, she will go and ask their senior sister, and again she will come and do. So the timely care there is missing.
so you want the skilled people. Okay, experience and skilled people you want, right?
Yeah, especially this isolated patient. They can, but they can handhold the new joiners, but they cannot leave them alone, the new joiners.
Okay. Anything else you want to say? Okay. Okay. Thank you so much. Such a vital information you are sharing, which is not difficult, but it is very vital and very important. We should be approachable. We have to give the proper explanation of everything in advance. And of course, the third thing, most vital thing, when any patients comes to our hospital, they don't want to be guinea pig. We have to give the experience hands that we understand, but so much of high turnover in all hospital. It's really a challenge for us. However, we'll definitely keep in our mind, to post only the experienced people or good hand-holding approach from the learned people to the novice people. Thank you so much for sparing your time, and this information will be adding the value to our profession. So thank you. So any questions from other participants? Ma'am Roslyn, do you want to say anything?
No, ma'am.
Okay.
Want to appreciate how you have taken it forward.
Yeah. So any questions from the other participants? Okay. No questions. So then I just would like to share one information. If you want to go to Tamil Nadu, Chennai, then you can book your ticket for 24th and 25th of May. We are going to have Anikon conference, national conference. And particularly, I would like to request you all and to send the nomination of yourself and others for their different awards, young leader nurse and best lead nurse, trendsetter nurse, and lifetime achievements. So so this is my request to you all, and connect with your chapter heads. You can get it details, and looking forward. And 20th will be the 20th April will be the last day for nominations. That's all from my side. Vinci, do you have anything to say? Vince is not here probably. Otherwise, that's all for my side. And Ma'am Lina, you have anything?
Yeah, Dr. Rachel, over to you, ma'am.
Yeah,
Okay.
thank you. Thank you, Dr. Umana, for organizing the Empower Hour every month so meticulously, which is so useful to our staff nurses. And my own students are connected. I'm sure they have taken a lot of informations from this. And Ms. Leena Chandrasekharan, the president of the Tamil Nadu Chapter, because all are busy with the annual 2024. So her entire team has worked towards making this day's program successful. And Ms. Vincy, Secretary of Annie, for giving the opening remarks. Thank you so much. And I appreciate Ms. Palniammal as a patient for giving patiently. You have given your feedback so well for all the questions which was asked to you. I appreciate Ms. Palniammal and the team, Dr. Jose and Dr. Sneha and also Ms. Baby Lakshmi for throwing questions. Normally we get feedback in a written form. So if we could take time to talk to our patients as we do our care and get some feedback, probably before the discharge, we will be able to get a lot of information. So I appreciate the entire team for organizing it so well. And I'm sure the audience who have connected at the noon time when you're busy at the hospitals have also taken up a lot of information. Thank you so much, the entire team.
Thank you so
Looking
much,
forward to
Rosalind
meet
ma'am.
you on Anicon at Chennai on 24th and 25th of May. Thank you.
Thank you.
Thank you
Thank you.
so much, ma'am.
Thank you. Have a good, yeah.
Thank you.
Bye.
Thank you. Thank you then. Bye for now. See you the next month with Kerala chapter. Okay. Thank you.
Thank you.
अपकमिंग होती टेबल बर्न 3 कर दिया ना 25 चाहिए ना उसमें 25 के जगह पे इन लोग है 30 समथिंग 33 है 25 8 स्टाफ एक्स्ट्रा है वो लोग कभी ऐसे इंदु में एक दिन लॉजिक दे रहे थे नहीं एक्स्ट्रा तो नहीं है ना मैम 25 और 17 मिला के तो 42 हो रहा है ना 9 कम स्टाफ